Question 18. In which stages of HIV infection does the victim show no signs but any medical reveals the presence of the virus in the blood? A. Incubation. B. Full-blown. C. Symptomatic, or D. Window. Students should first of all understand the 4 stages of HIV infection. Stages of infection, assuming no treatment. There are 4 stages of HIV, and as with all illnesses, how it progresses, how long it takes and the effect it has on the individual depends on a number of factors, for example, general health, lifestyle, diet, etc. Stage 1, Infection. HIV quickly replicates in the body after infection. Some people develop short-lived flu-like symptoms, for example, headaches, fever, sore throat, and a rash within days to weeks after infection. During this time the immune system reacts to the virus by developing antibodies. This is referred to as seroconversion. Stage 2, Asymptomatic/incubation period. As the name suggests, this stage of HIV infection does not cause outward signs or symptoms. A person may look and feel well, but HIV is continuing to weaken their immune system. This stage may last several years, an average of 8 to 10 years, and without a HIV test many people do not know they are infected. Asymptomatic HIV infection is the second stage of HIV/AIDS. During this stage, there are no symptoms of HIV infection. This stage is also called chronic HIV infection or clinical latency. During this stage, the virus keeps multiplying in the body and the immune system slowly weakens, but the person has no symptoms. Stage 3, Symptomatic. Over time the immune system becomes damaged and weakened by HIV and symptoms develop. Initially they can be mild, but they do worsen. Symptoms include fatigue, weight loss, mouth ulcers, thrush, and severe diarrhea. The symptoms are caused by the emergence of opportunistic infections. They are referred to as opportunistic infections because they take advantage of a person's weakened immune system. Some examples of opportunistic infections are PCP, toxoplasmosis, TB, and Kaposi sarcoma. Early symptomatic HIV infection includes persistent generalized lymphadenopathy, often the earliest symptom of primary HIV infection, oral lesions such as thrush and oral hairy leukoplakia, hematologic disturbances such as hypoproliferative anemia and thrombocytopenia, neurologic disorders such as aseptic meningitis, and dermatologic disorders such as varicella-zoster virus, shingles. Stage 4, AIDS/progression of HIV to AIDS. There is no single test for AIDS. Doctors will look at a variety of symptoms including the CD4 count, the viral load and the presence of opportunistic infections in order to make an AIDS diagnosis. Although HIV disease progression is described in stages, it is not inevitable that a person will go from stage 1 infection to stage 4 AIDS. There is treatment available that can prevent a person developing AIDS and deal with the symptoms of HIV infection. There are a number of people living with HIV who have not developed AIDS even without medical intervention. These people are referred to as long-term non-progressors and have been subject to much research in the hope of finding more information about their immune systems. Therefore, from the above the explanation, the correct answer is A. Incubation.